Hi everyone again. Welcome to today's webinar. This is brought to you by AKL Academy and sponsored by AKL Pediatric Therapy. I'm Daniela and I'm happy to be hosting this session today. We're fortunate to have Ana Pedraza with us once again. Ana is an exceptional occupational therapist with an extensive clinical experience. She's been working with children with autism, focusing on sensory integration, routines, and more. Today's topic is how to respond to tantrums in children with autism, practical steps for parents, teachers, and therapists. It is a situation that many of us encounter regularly, and Anna is here to help us to navigate it. She is ready to share some great insights and practical tips that you can start using right away. Anna, the virtual floor is yours. Welcome again.
Thank you. Good afternoon, everyone. As Danielle mentioned, we apologize for the delay, but here we are. Okay. Our today topic is about tantrums. But before to start, we need to think about in the difference between tantrums and meltdowns, that this is a typical behavioral thing that all of us has to deal with our autism children. Danny, can you please next one? Okay, so as I mentioned, the first thing to do is that we need to understand and know what is a tantrum and what it is a meltdown. So tantrums are normal behavior in the development of the children, in typical children talking especially as well. And if we talk about autistic children, this is another situation as well that happens in their behavior. It especially occur in the early age. They are still learning to manage their emotion and to express themselves. So this occurs when they are learning how to work in problem solving, and they are challenging their independence. Why this happen in these early stages, like between 12 months through 4 years old, are the most typical ages when these tantrums occur, and then later on. But this happen in these especially ages because our children are learning and understanding how to merge and desire to become independent. They have limited motor skills and cognitive skills like planning, organizing, execution, which make it impossible for them to be independent. Of course, they are emerging in developing language skills, and as they have difficulty expressing their and communicating what they want and what they need, these tantrums occur as well. And the prefrontal cortex of the brain has not yet developed. So this is the area of the brain that is responsible for emotional regulation, social behavior, and they don't have this ability to regulate. Also, toddlers are developing understanding their own world, the anxiety that this produces, and to control what is happening around them. Usually, children who demonstrate temper tantrums frequently struggle with impulse control, problem solving, delaying gratification, negotiation, communication wishes and needs, and knowing what is appropriate in given situation and self-serving. Next one, please. Now, in another way, we have sensory meltdowns. So sensory meltdowns are reactions of feeling overwhelmed and are often seen as a result of sensory overstimulation. So this means that there is too much sensory input causes overstimulation of the body, and the nervous system goes into fight or flight or freeze. This can cause aggression, crying, screaming, running away. That this type of behavior, what is showing us is that they are dysregulated. And it looks like a tantrum, but has different cause. This, in another words, is that our children has sensory needs, and sometimes they cannot control what is in the environment, and that's why they react in this way. Next one, please. So how do we differentiate the tantrum to the meltdown? What we need to do in first thing is to understand our sensory environment, the sensory environment of our child. We need to identify the reasons. Why are they reacting like that? The feelings, what is happening in their bodies, in their brains. For example, if there is too much noise in the environment, if we are in a grocery store or something like that, they cannot process that information in their brain, and that is what it causes a meltdown. We need to see and analyze their needs. I really like this picture because it has some examples of what is happening in our children body and brains. So in some cases, maybe they have complaints about tags in their clothing. In another cases, maybe they don't like that we wash their hair or the haircuts, or maybe some smells, or maybe the feeling of being touched, or they need to touch really hard to others to feel that. So this is more about the sensory needs of our children and how they can react as a meltdown when there is too much sensory information in the environment. Next one. So if we can understand a little bit about one situation, or what is a meltdown, or what is a tantrum, what we need to do, that the big question to us is, okay, what should I do? I'm in a tantrum. What can I do to help my child? So the first thing to do is that we need, if we are in a tantrum at that moment, we need to make sure that our child is safe. We need to keep everyone safe. If they are, I don't know, maybe eloping or running away, or they are having an aggressive behavior like hitting or kicking or biting, we need to make sure that we have a plan to keep our child safe. We need to see around the environment. Maybe if we are in a grocery store, we need to move a little bit away when there is a place that is safe for everyone. If we are in our house, we can set special space where our child feels safe. We're going to talk about a little bit more later about those sensory strategies that we can improve and how can we work on them. But the first thing is we need to make sure that everyone is safe. I have to be safe as well, as a parent, as a teacher, as a therapist. I need to feel safe to transmit that safety to the child. The other strategy is that we need to understand their emotions. We need to understand if it's something that our child didn't get on their way, that they want a candy or they want the tablet at that moment, and that's why the tantrum comes up, or it is a sensory overwhelm that is not helping them to be around. We The tantrums, I think, is challenging us as an adult because it's challenging our calm. So I know it's hard, but we need to be calm. We need to stay calm, because what we transmit to them is what is going to help them go through or stay in the tantrum longer. So it's always challenging our feelings and our emotions. And one big thing that we have to think about is trying to be calm. We need to set clear limits. As I mentioned before, we need to have a plan. We have to think about, okay, if I'm going to this place, what I'm going to do if this happens. So when it happens, we know what to do. Um, we have to offer choices, like for example, that I'm going to get a deeper view later. But if I have, I don't know, our child is in a tantrum and they don't know what to do. What I can offer is maybe an option how he can help calm himself. Like, I don't know, like a squishy ball. If we squish this ball, maybe we can count until 10 and we can calm down a little bit. So it's like offering them choices how they can manage that situation. Mm, in regards to that, of course, it connects with distract their attention, but we don't want to talk too much at that moment, because when they are in a tantrum or when they are in a meltdown, they're not going to be like talking to you calmly and telling you how they're feeling, because that is a moment when their brain is just in firefly. They are not going to talk to you or trying to negotiate a situation or something like that. So in that moment, we need to stay calm, breathe, and let them just go through that moment. We can be next to them, we can be their support, but try to don't talk too much. Just being there for them is a good way to manage this. um, these three strategies, like teaching emotional skills, ignore negative behavior, and reward good behavior, are strategies that we need to work in daily routines every day, that we need to teach them, we need to model them. And when the tantrum comes, they will know what to do and they will know how to understand and feel their emotions. I'm going to talk to you about this. Okay, next one. Okay, other things that we can do that help us and give us support about like regulation in a daily basis. Working on visual schedules. We have been in another webinars talking about the visual schedules, but if our child knows what is going to happen during the day, or if we are going to change something in their routines and they have it visually, it would help them to be organized, like in their brain, in their body, how to react over different kind of changing situations. Like I know that maybe sometimes tantrums can come when we have changes in the routines, like we are going to grandma's house but we didn't go that day, so maybe it will come a tantrum. So if they have like the visual, um, step by step what is going to happen in the daily days, they will be easier for them to manage that. Another strategy that helps a lot in understanding emotions and changing in routines and help them go through those tantrums is working social stories. So something that comes to my mind right now is, for example, we are on vacation, but we're going to start school again. So if we make like a social story, like telling them what is going to happen, you're going to be with, I don't know, Miss Pedraza, and you're going to be with your friends, and this is the route to go there, and they have pictures, and we are telling them like a story that will be easier for them when those changes happen. So that's a really good tool to work. We can have check-off list, like to-do list as well. So it will help them to be more independent, or we can work with cars, like for example, when I put my shoes, I can go to the park, or things like that that connect information and give them strategies to understand themselves and be less in a tantrum. Um, of course, activity of task schedules. So as I said, sometimes they need like to unorganized routines. So if we are better on that, that will help us get less tantrums as well. Another thing that we can use is sensory diet activities. And it helps with tantrums and it helps with meltdowns, because sometimes when we get them the right sensory input to their body, to their needs, that will help us to get less dysregulation of their body. So maybe like weighted blankets sometimes during sleep, it will give them that sensory proprioceptive input and help them to be calm. Maybe sometimes going in a swing, or different type of motor activities like jumping, running, that will give them to their brain and body the sensory input that they are searching sometimes. So that will help us. But we can set it in our daily routine, like every day we're going to do 5 minutes of motor activity, or we're going to do 5 minutes of swing, or things like that. We can improve that in our day-to-day. For this part, we can work in close by with our therapist, so they can help us to know what our child needs, what can we do, and how can we implement these activities in our daily routines. Next one, please. Okay, so in regards to what I mentioned before, what we want with our children is we need to build their emotional regulation. We need to build their emotional intelligence. What means? This means that they are able to identify their own emotions. They are able to connect with other people's emotions as well. They can be more empathetic. They can create more connection with other people. And this is because we want to improve their social skills, we want to improve their confidence, their emotional thinking. So this is a strategy that we need to work every day. Next one, please. So how can we work on that? There are different like programs of strategies to work on that. One of them that I want to bring to you today is the regulation zones. I like this because it's a like a big picture of different type of emotions that we feel every day. In different times of the day we can have different emotions, and it happens to all of us. This is not something that our children deal with. This is something that all of us manage and feel, and have to solve and make solution about when we feel like that. So we can like print it out, have it in the room or in the classroom, and it's a strategy that we can work with them every day. Because as I mentioned, when they are in a tantrum or when they are in a meltdown, we're not going to deal with them too much. But when they are calmed down, when they are like in another like position and way to understand, will be easier to learn and to teach them how to manage that emotion. So when the tantrums come, they know and they have the tools to manage that. So this is, as I mentioned, this is a strategy. We can just print it out and explain to them, talk to them. Like, okay, blue zone. Blue zone is when we feel sad, when we feel hard, when maybe we feel sick or tired. So what can I do to 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 go when, or what can I I don't know, think, or what are the actions when I feel this way. So for example, in this picture, it says that when I feel like that, I just need to rest. I can take a break. I can ask somebody to help. I can maybe talk to someone if I feel like that. Or I can, if I'm feeling like down, maybe I need to activate my brain. And one way to activate my brain and my body is like maybe jumping up and down like 5 times. So this is like an examples that we can implement when we feel this way. Also, we can ask them like, okay, what else can we do when you feel sad? What else can help you to get through? So it's just working with them every day and teaching them and telling them. The green zone is more when I feel happy, focused, calm, excited as well. It's like the zone that all of us want to be all the time, but that doesn't happen. It's just some moments, but this is the zone when I feel that I can make it, that I feel happy, I have happy thoughts, I finish all my work, I can help others, and I can share ideas. So this is the zone when all of us work like really good. Um, so the yellow zone is more when I feel like surprised, when I feel confused, I feel worried, I feel silly as well. So in this zone is when we need to slow down. So what it means is slow down. Take a deep breath. We can maybe talk to someone, go for a walk. We can count until 10 when we feel like this. So these are like examples of strategies that we can implement when we feel this way. And the red sun is like the song when we feel angry, we feel raging, we feel terrified, annoyed, frustrated. And this is the song when we need to stop. We need to stop because when we feel like that, we can, it's when we are kicking, we are yelling, we are doing another expressions that we don't want to have. So it's the song when we need to stop, we need to take a time out. Maybe if we have like a weight blankets or weight pillow, that will help us to calm down, like putting in our lap, or like getting around our body. Squishing a stress ball will help. Drink water. And of course, these are like big examples that maybe not all the strategies work for us, but we need to find out which of these strategies works for our child, works for me, that help me go when I feel in my emotion in this way. um, if of course, if we want to go deep on this and get more support for our child, we can help you with that, and you can work closely with your therapist, and that will be really good. Okay, next one. This is another program that it's called Alert. That means that we are working on our child, that they feel and they understand their body, how in a relation, how maybe an animal works, or a engine of a car. So it's more like, if I feel like slow, I feel just right, or high. So in it depends what works for us, like comparing maybe with an animal or with a car engine. But the point is like, okay, when I need to stop, when I feel just right, remember, it's the green zone, I feel great, I can help others, I can be really good. But when I feel slow, I need some strategies like to activate. And when I feel high, I need to stop a little bit. So it's different comparisons, but we can also work in this strategy with our children. Next one. Another technique is the traffic light. So the traffic light is used in boys and girls, so that way they can identify their emotions, how they feel in certain situations. So the idea of this strategy is like replicate the format of a traffic light on public roads through stopping, caution, and continuing conflict moments that may arise. So when I have the feeling like the anger or frustration or any of the feelings, what do I need to do? So it's like stop, I need to stop, pause, and take a deep breaths. Feel and try this. This strategy is more about like giving a name of that emotion, like trying to identify, okay, how I'm feeling. I need to stop, but I'm feeling anger, I'm feeling frustrated, I'm feeling sad, tired. So it's more like trying to identify how I'm feeling. Then the yellow light will be more about thinking, so it's like when that emotion just come down a little bit, then I need to think why I'm feeling that way, and maybe trying to come up with some solutions or of some options, how can we solve how we feel like that before. And the green line we is more about like connecting, like, okay, what can I do, choose how can we react, if that feeling, it's okay to feel like that, because one thing with emotions is that sometimes we think that if we feel anger is like is bad, and it's not. It's like all of us can be sad, can be frustrated, can be happy. All of those are emotions, and it's okay to feel like that. But the point is, okay, what should I do when I feel like that? So to give just an example, maybe um the frustration of the anger comes because our child wants to bring their favorite toy to the school, but the toy was left in grandma's house. So they were like, I want my toy, I can find it. And so it's like, okay, stop, take a pause, how you're feeling, frustrated. Okay, as an adult, I will say like, okay, I understand that you're feeling frustrated or that you're feeling sad because your toy is not here. So then we just begin to think with them when they're just calm down a little bit. Okay, what should I do? What should we do? Okay, your favorite toy is not here, but we have I don't know, green ball, or we have another car. So we give them options, not too much. I suggest like 2 options. So they can pick one of those options that you are showing them. And then the solution is like, okay, we are bringing this toy today or another toy. And later on, when we get back from school, we can go to grandma's house and pick up your favorite toy and take it to the school and the next day. I don't know, it's an example, but it's just a way how we can manage that situation and help them go through that feeling. Next one, please. Okay. Another important thing when talking about this topic is to use sensory strategies and sensory activities to address that emotional intelligence. So we need to be the model for them. We need to model how identify emotions. Like, for example, if we are in the supermarket and we can't find any item, we can be like talking to them or showing them how I'm managing that situation. Like, okay, I'm feeling sad or I'm feeling frustrated because I can't find the tomato sauce. But let's look around if it's in this shell, or if I can find it in another place, or I can ask someone where I can find it. So I'm modeling for them how to react in this situation and how I'm feeling about conversation about emotions during the day, like maybe at the end of the day, sharing during dinner, like, okay, today this happened to me, I feel this way, and I make, I don't know, a conversation with a friend and I feel much better. So it's like giving them tools how they can understand and manage their emotions. Um, and it's good to connect emotions with sensory activities. So as if you see before, like when I feel sad and I feel tired, I need to like move my body, so that helps me activate. And when I feel like excited and everything, I need just to calm down, so maybe like um moving in a swim, or maybe rocking a little bit help me calm down, or maybe a hug from mom help me calm. So it's like connect that those sensory activities with different feelings helps them to know what to do. So for example, another thing will be when I feel anxious, I just chew a gum, or when I feel tired, I jump 10 times, or I go to sleep, or I be like rocking. So it's just, we need to understand our child and helps them to find what is helpful for them. Next one, please. Another strategy, as we mentioned before, the social stories again, um, create social stories, help them deal with changing situations, what happens, how will they feel afterwards. So in regards to changing routines, starting new things, doing something new for them, social stories will be a really helpful strategy to work with them. And another one that I really like a lot is to create a sensory corner of calm in the house. Also works for school. So in the school, in the classroom, we can also make like create a sensory corner. This means that we are going to create a safe space in our house. So it's the place where they can feel calm, when they can go when they are feeling that emotion, when they are in the tantrum, when they are feeling frustrated, and they need to calm down. So this is a place that we can create together with them. We can take their favorite toys, we can take some tools, I don't know, like fidgets, or maybe puzzles, or we just created depend of our children needs, but it's a place where they can feel safe. I can be just sitting next to them, being just for them, without like telling too much. But this is a place that is not only to work when the tantrum comes. It's a place where we can like maybe implement in our daily routine, like every day we can have 5 minutes in that sensory corner, and is the place where they feel good. So when the tantrum comes, they will know that that sensory corner is the place where they feel calm, and that helps them to get in peace with themselves, and then later on come back to the routines or what the activity they are doing. So it's a space that we need to teach them. We need to talk to them, practice, teach, model, repeat. This is not something that we just do once and then just it's going to work. It's a place when that we can just repeating that action, repeating that, and maybe when I feel like as an adult, when I feel like I can handle something, I can go to that corner. So that way I'm modeling to my child that when I go there, I'll stay calm. That helps me a lot. Next one, please. Okay. There are many things in this topic, but the big thing is that we need to to work a lot in our own emotions. We need to be calm and regulated, because if I'm yelling, my child will see that. If I'm stressed out, my child will see that. So if I'm not calm, if I can't transmit that to them, that is not going to help them. I know that when the tantrum comes and I don't know, they want a candy bar in the grocery store, and the easy things is just give it the candy and I don't get the tantrum. But what happens is that they learn that if they do something, they get what they want. And that's what we don't want about the tantrums, that how we like give nutrition to the tantrum. We feed the tantrum, making those repetitive behaviors and actions. And that's what we don't want. We need to make actions. And in regards to that, that's why we need to stay calm and we need to have a plan and what we're going to do. I know that right now the use of technological tools like tablets, cell phones, screens is not helping us, because when we are taking away that tool from them is when the tantrum comes a lot. So maybe settle some schedule during the day, like, okay, this is the time you use it and that's it. But we need to teach and practice and work in that every day. And that's a really good tool to have less tantrums. But it's more about routines, it's more about teaching them and modeling them. Okay. Next one, please. Of course, something that I really always say is that we, all the people that is around our child is a big team. So we need to work together. We need to set the strategies together. This is not something just from parents, from therapists, from teachers. This is something that all the people that is around the child needs to work, needs to practice, needs to model. And that's why we need like close communication to all the team that is around our children. So talk closely with the teachers, with the therapists, something that maybe, I don't know, the occupational therapist is working with my child and it's working. It's something that it has to be shared with the rest of the team, because that way we help our child to get better, to be independent, to work through their emotions, through their behavior. So close communication as a team is really important in all of this process. Well, we really appreciate your time. I hope this information was nutritious to you. Of course, if you have any questions, you can write it down in the chat box. If we have, well, you can write it, of course, as well in our social media as well. We really appreciate your time. And of course, if you need deeper supervision or deeper information about this, you can contact us anytime. Thank you.
Thank you, Anna. Well, actually, we have received some questions through Instagram and also to this message box. I would like you to tell us a little bit more on how important is that the kids stay consistently in therapy to de-escalate the frequency of the tantrums. Sometimes we see patients that just receive therapy one POC or once a week, or they just receive therapy at school. How can consistency in therapy can help with tantrums and meltdowns?
Well, the consistency in the therapy, of course, um, will be really important in terms of like seeing results sooner, because if we work with a child and only once a week, or I don't know, maybe sometimes two, okay. But if we work closely, as I mentioned, as a team, not only with therapy, but also getting close communication with all the team that is around our child, it will help us to get better results, to see mature behavior, better communication, better of course, motor skills. And by the time that we work with our child in therapy, we are not building only or working only in the need in terms of therapy.
Well,
We are
yeah, just
working
the goals.
as a whole person. So setting routines, being able to follow instructions, all of those skills will help us to get better results. And of course, if we are really close with the process, we maybe we may not need therapy later on, but in the early stages, in the early ages, we need to work hard, so that way we can build our child strong, and that way he will be able to handle the things of the world later on. Because the point of therapy, of course, is help them and grow with them. We don't want therapy for the rest of the life, but sometimes, of course, depend the cases, but what we want is to build strength in that child.
Josanna, and we have talked a lot about how to involve parents, teachers, and our patient, of course, on the therapies. How about siblings? How can we involve siblings in this process? Because, of course, when it's an only child, we as a caregivers, give all the support. And what about they have some brothers and sister, or they live with extensive family? How important is to involve them in this process?
Wow, that's a good questions. And as I said before, it's very important to teach in it in the daily routines and involve all the people that is around them. Because it doesn't work if I'm the one, I don't know, talking as a mother or as a father. I'm the one just implement the strategies and work with my child in the strategies and teaching them how to understand their emotion and everything. But maybe the grandma is giving them the candy right away. So we need to involve all the people that is around our child in the strategies that we are working with them. That way, we are going through all of this situation in a better way. And of course, it happened the same with the brothers and sisters, because doesn't work if I'm doing that strategy with my child, but maybe the older brother or sister is getting what they want, and they don't have consequence, or they don't have any strategy. So it's something that we have to implement as a family, as a group, and of course in a school setting as well. We need to implement it as a group as well.
Thank you, Anna. And the last question is coming from here from the Zoom chat. Lady, thank you for your question. She asked, what type of sensory toolkit can I have on hand to help my child when he's having a meltdown or a tantrum?
This is very important. We can we First of all, we need to understand our child needs. So for example, if they are really sensitive to light, like having light sensitivity, we can use like sunglasses. or if he doesn't like too much the noise, the sounds of the environment is too loud for them and is not helping. We can have like headphones for canceling sound. But we need to understand what our child needs, and in regards to that, we can have some sensory tools like that. But weighted lap pad or weighted blankets helps them a lot. A swing as well sometimes. Most of our children, if they are like picky eaters, or sometimes they need to chew or bite things. So maybe having a chewy toy or a tool that is helping them calm down, that will be good as well. Maybe when they don't like to be like dirty in their hands, well, we can have unhanded like wipes so that we can clean them right away. Fidget toys helps them a lot when they are in a meltdown. So yeah, if in that case, what we need, and we can work, is with our therapist. We can review the special needs and have the right tools. But a lot of fidgets helps them a lot. And for example, in my case, I like the bottles, the light bottles that is like visual stimulation, and that helps them calm as well. But yeah, in regards to that, we need to go deeper into our child needs.
Well, thank you again, Anna. Here you have our social media accounts. We are in every social media, in Facebook, Instagram, YouTube, um, Indeed, LinkedIn. If you feel you need some help from us, or do you want to bring your child to receive therapy with us, I would like to let you know that we have new openings to receive patients for the new year that is about to start. We're really happy to keep contributing to our community of families and kids with disabilities. And we're always here to give you tips and strategies to navigate these diagnoses and some others. With Anna, there's a big clinical department that, the same as her, is really prepared regarding these subjects. And if you find any value in these webinars, please do not hesitate and give us like a review on Google. You can go, all of these webinars are always uploaded in our YouTube, and you can go to them all the time. You can also find some printable material on our website. It's a lot of resources that you can use. And of course, you can email us or leave us a message, and we can help you in everything you need regarding this. Um, well, if anyone has any other question, today is our, we finished right now, and we will be with our next webinar in 4 more weeks. We will be posting the date and the topic, and we hope to count on you the next time as well. Anna, once again, thank you so much. We have learned a lot from you, and have a great day. Everyone, thank you for joining us today.
Thank you.
Bye.
Bye bye.